Hi everyone. Today we are talking about a condition which affects millions across the globe, the fatty liver disease. Did you know the fatty liver disease is one of the most common liver disorder worldwide? In fact, research published in high impact journals suggest that fatty liver disease prevalence is increasing in countries where the lifestyle and high caloric diet is common. So what fatty liver disease is? What are its cause? What are different stages? What are the treatment options? And how we can prevent or manage the disease by changing the lifestyle? Let's break it down. Fatty liver disease occurs when fat accumulates in the liver cells. A healthy liver typically contains little to no fat. But when more than 5% of the liver weight is fat, it becomes a concern. There are two main types. Alcoholic fatty liver disease. This is caused by extensive alcohol consumption, which overwhelms the liver's ability to process fat. Non-alcoholic fatty liver disease. This occurs in people who drink little or no alcohol and is primarily linked to lifestyle and metabolic factors. Non-alcoholic fatty liver disease is particularly concerning because it's becoming more common, even in children and young adults. Alarmingly, research published in top-tier journals suggests that non-alcoholic fatty liver disease may soon overtake viral hepatitis as the leading cause of liver transplant. The exact cause of non-alcoholic fatty liver disease isn't fully understood, but scientists agree that it's closely tied to the metabolic syndrome, a cluster of conditions that include obesity, insulin resistance, high blood sugar, high blood pressure, and abnormal cholesterol level. Here are some major contributors. Obesity, especially visceral fat around the abdomen. Insulin resistance. This makes it harder for your body to regulate blood sugar and fat storage. Diets high in refined sugar, saturated fats, and processed food increase the risk. Some people are genetically predisposed to store more fats in their liver. Interestingly, study published in a journal Cell have shown that even normal weight individuals can develop non-alcoholic fatty liver disease if they have poor metabolic health or certain genetic markers. Fatty liver disease doesn't happen overnight. It progresses through 4 stages. Steatosis. This is the initial stage where excess fat builds up in liver cells. It often symptomless and reversible with early intervention. Non-alcoholic steatohepatitis. In this stage, fat accumulation triggers inflammation and damage to liver cells. This is critical turning point because untreated non-alcoholic fatty liver disease can lead to scarring. Fibrosis. Persistent inflammation causes scar tissue to form around the liver and its blood vessel. While the liver can still function at this stage, the damage becomes harder to reverse. Fourth is the cirrhosis. This is the most severe stage where extensive scarring disrupts liver function entirely. Cirrhosis increases the risk of complications like liver failure or even liver cancer. It is important to note that not everyone with fatty liver will progress to cirrhosis. Many cases remain stable for years if managed properly. Currently, there are FDA-approved medication, especially for NAFLD or NASH. However, research published in Science shows promising development in drug therapies targeting inflammation and fibrosis pathway. Until these treatments become widely available, management focuses on addressing underlying conditions like diabetes and high cholesterol. For advanced stages like cirrhosis or liver failure, a liver transplant may be the only option. However, prevention and early intervention remains key to avoid this severe outcome. The good news is that fatty liver disease is largely preventable and even reversible in its early stages with lifestyle changes. A Mediterranean diet has been shown in the study published in Nature to reduce fatty liver disease and inflammation significantly. This diet emphasizes fruits, vegetable, whole grain, nuts, legumes, olive oil, and lean protein source like fish, while limiting processed foods such as sugar and saturated fats. Reducing sugary beverages like soda can also make a big difference. Regular physical activity helps burn excess fat stored in the liver and improves insulin sensitivity. Aim for at least 150 minutes of moderate intense exercise per week. Brisk walking, swimming, or cycling are great options. Gradual weight loss, around 1-2 pounds per week, is highly effective for reducing liver fat and improving overall metabolic health. Rapid weight loss should be avoided as it can worsen the liver inflammation. Both smoking and alcohol can increase liver damage. Even small amount of alcohol can worsen the non-alcoholic fatty liver disease progression. Poor sleep quality has been linked to increased risk of fatty liver disease due to its effect on metabolism and inflammation. Finally, regular checkup with your doctor are essential if you have risk factors like obesity and diabetes. Fatty liver disease might sound intimidating, but with awareness and proactive approach, it is manageable and often preventable. By adopting a healthy diet, staying active, maintaining a healthy weight, and managing underlying health conditions like obesity and diabetes, you can keep your liver healthy. Thanks for watching. If you like this content, please give a thumbs up and subscribe for more exciting science update. See you next time.